Hi, class. This is the last lecture. This actually comes from Bellinger, which is not a text that you have. It's just recommended reading. You will get this in ortho as well, so I'm just going to briefly go over hydrotherapy. I'm guessing you went over this a tad bit last year in your patho class. So I'll just give you kind of a foundation so that you have this, so that when we get to ortho, it will all seem brand new to you. Okay, here we go. So we have the different properties of hydrotherapy. Talk about that specific heat and that thermal conductivity. There's the buoyancy, there's resistance, and there's hydrostatic pressure. And these are all some of the things that make hydrotherapy good for certain types of conditions that we may use therapeutically in physical therapy. So just looking at the different clinical applications, know your definitions of these, okay? Know what buoyancy is, look up Archimedes' principle and the different clinical applications of that. So let's say you have a total knee patient, has a lot of compressive forces on land. You can imagine that what that buoyancy is going to do for those joints. But kind of think also, ask yourself the question about how that's going to affect the muscles, in what way, okay? Resistance. Again, look at your definition for that. The properties, viscosity, speed, contact, these all will vary and affect the amount of resistance, so that you can make it easier for a patient and you can make it more challenging for a patient. So obviously the faster moving the body results in more resistance. So that's something we do when we're trying to progress them. If they're just beginning and we don't put a lot of pressure on them, then we'd have them go very slowly. Paddles and fins will increase the frontal area, increase resistance a little bit. Limbs straight in front, decrease the frontal area and decrease resistance. Okay, so those are just the different things depending on the person's pathology that you can use as an advantage. You might want to use the fins, you might want to use the paddleboard. Okay. We have this thing called hydrostatic pressure. Again, I'm going to have you just do the reading on this. We'll follow through with this when we get to orthopedics lab. The different physiological effects of hydrotherapy. Okay, you can get that superficial heating and cooling depending on the temperature of the pool. It affects your musculoskeletal system, your cardiovascular system, your respiratory system, your renal system, which we know are your kidneys, right? Psychological effects and cleansing effects. So really you have to be very cognizant of a person's, all their comorbidities that they might have when you decide to do hydrotherapy on somebody, because it is going to affect all their systems, sometimes in a positive way and sometimes not, sometimes a little too challenging for them. So you have the both, all the same things that are going to be affected that we talked about with heat and cold therapy. We have the hemodynamic, the neuromuscular, the metabolic changes, and the soft tissue extensibility modifications that are happening. Okay? So your musculoskeletal, we decrease pain and trauma with exercise. We reduce the compression. We talked about this when I talked about the total knee due to that buoyancy on those weight-bearing joints. The velocity that we talked about, the speed, the slower you go, the less there's going to be on it. Subcutaneous fat, increased fitness, not effective in general for weight loss. Increase of muscular blood flow may increase the muscular performance. So there we talked about the strength. So if we can get more blood flow into a muscle, maybe it will perform better, and thus it will protect that joint for a little bit longer. Cardiovascular, 30% increase in your cardiac output and stroke volume. That's huge. But the decreased heart rate, decreased systolic blood pressure, oxygen consumption is lower versus exercise on land. So here you can see the pressure coming in on them. It kind of displaces that venous blood proximally. You get increased cardiac volume, you get increased stroke volume and cardiac output, which is great for some people, right? That you might get cardiovascular fitness, but think about those comorbidities where they're not allowed, or they don't have the capability to pump out that extra blood that's going up in to increase that stroke volume. So you'd want to be cautious with that type of diagnosis, okay? An increased work of breathing, increased resistance to your lung expansion, decreased vital capacity by 6 to 12%. You get a decreased expiratory reserve by 50%. So that's about 60% total. So this is why you see a lot of people who have asthma. Swimming is really works well for them, and are able to do this as a really competitive athletic event. So here we're just kind of talking about the different things, what happens. It's kind of tells you what happens to starting where you're going. Okay. So renal effects: increased urine production, increased urinary sodium and potassium excretion. So this decreased peripheral edema. So this is something that's unique to hydrotherapy. Okay, so it's kind of just the diagram showing you how that works. The psychological effects just can make you feel good, right? Whether it's hot or cold, there's different things that it can do for you. You have to really realize too that for people who are afraid of water, there's those opposite psychological effects we need to be respectful for. Cleansing effects: it hydrates, frictions, it debrides, it cleanses, an agent, and kind of talked about that. Don't use it very much anymore. They have wound vacs that are used a lot more effectively now for wound healing. Same thing with the water immersion. We do use contrast baths. There are exercise pools. We will be going up to the HydroWorks at Tri-City Wellness in our ortho lab, and so you'll get to see how that works. I have a video there. It's pretty cool to get to analyze somebody's gait and try different things. Okay. With a contrast bath, we'll go over that in lab, where you alternate between the hot and the cold to kind of help facilitate some healing and decrease swelling in a joint. Okay. Here's different parameters. Cold water, keep it somewhere between 32 to 79 degrees. Tepid is going to be up to about 92, and then that neutral warmth is going to be more for those neurological hypertonicities type people. Burns kind of have a more mild warmth. Hot and very hot, control of pain or increased soft tissue extensibility. And that's really going to only be usually used with a contrast bath, a small area. Here's your different indications. I'll let you read through those. It's depending on what you're trying to get out of them, you can get some increased circulation, you can get muscular strength, as we talked about. You can get increased blood flow that will to the muscle, will eventually have the end result of more muscle strength. You can modify the musculoskeletal demands by the buoyancy effect. Some joint viscoelasticity, which will then, all these things will help with your flexibility and your range of motion, because you'll have less pain, you'll have more strength, so ultimately you get more coordination and ambulation. It can improve your cardiovascular respiratory conditioning and your psychological well-being. And ultimately all these decrease pain, muscle spasm, stiffness, edema, assist in wound care, which all will relate to all these other things that they're going to help with. Okay? So a maceration around a wound, that's that area, this just got too much moisture. We don't want that. Bleeding, you don't want that. Precautions, obviously we talked about not being able to, your sensations impaired, so you're not going to be able to tell the temperature. Infection in the area, you don't want that to be immersed. This person's confused. Whoops, sorry about that. And recent skin grafts, we don't want to do that as well. Okay. Full body immersion, cardiac instability, we just talked about that because you have that increased stroke volume. You really be cautious of those people who have cardiac instability. Infectious conditions that may spread to the water, so nobody with MRSA or any kind of bowel incontinence. Severe epilepsy and suicidal patients, you want to avoid putting them in the pool. Other precautions, we talk about confusion, alcohol, digestion, limited strength, endurance, and balance, medications, incontinence, fear of water, and respiratory problems. Okay? Precautions for that very hot or very warm water, obviously pregnancy, multiple sclerosis, and poor thermal regulation. You come here with multiple sclerosis, the cold really does help with their spasticity, so you kind of want to be cautious of that. Adverse effects, obviously number one would be drowning. You're not going to leave the patient alone, so that's not going to happen. But if you were to tell them this here's a program you can do at home, and they aren't safe, so that's probably not a good home exercise program. Burns, fainting, bleeding, infection, aggravation of edema, and an asthma exacerbation. So you just want to be cognizant of those and forewarn your patient, these are the things we do not want you to feel when you're in the pool, and please let us know so that we can adjust and modify to avoid those. Okay? These are the application techniques. We'll go through this when we get to ortho. And same thing, we're going to just kind of bypass whirlpool safety issues for that. Here's just an example of a subjective soap note. We're not going to be doing that, so you can just kind of look at that and maybe you could interject it with one of the other modalities. Okay, we'll see you soon. And again, just a reminder, this will not be on exam 1. This is just a little bit of foundation for you to start reading about hydrotherapy so you'll be prepared in your ortho class when we go over it. Okay, thanks. Bye.